Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, clinically significant macular edema. This clinically significant macular edema is a part of diabetic retinopathy which is detected on the clinical examination, and it is defined by early study for diabetic retinopathy. So, it is actually defined by ETDRS, which is ETDRS is early treatment of diabetic retinopathy study. So this cystoid macular edema, which is a clinically significant macular edema, is defined by early treatment of diabetic retinopathy study. According to this definition, it has three components. So ETDRS, which is early treatment of diabetic retinopathy study, if we see the definition of this, right. 1. Retinal thickening should be within 5 micrometers from the center of the macula. So, if this is the optic disc and this is the macula, if there is retinal thickening from 500 micrometers from the macula, then it is clinically significant macular edema. If there are exudates are present at 500 micrometers from the center of the macula along with thickening, if exudates are present, or if the thickening is present for one disc diameter or 1500 microns larger, or any part of it which is one disc diameter from the center of macula. So that means if it is almost 1500 micrometers larger area of thickening is seen anywhere from here to here, the thickening of retina is seen, then all these will actually project to presence of clinically significant macular edema in a patient with diabetic patients.
thank you and thank you for watching.